Mabuhay! I am Nicolay and Nobleza from the 13th group, and me and my groupmates, John Ubel and Navarra, John Pernick R. Navarra, and Honey Pearl S. Patricio will be discussing sexual disorders. Sexual disorder is a difficulty experienced by an individual or couple during any stage of normal sexual activity, including physical pleasure, desire, arousal, preference, or orgasm. For the disease process in the image, you can see that the first three categories discuss the factors that may lead to different types of sexual disorder and its subtypes. The first category is the sexual dysfunction symptoms that are according to the Diagnostic and Statistical Manual, 4th edition. It is characterized by disturbance in sexual desire and in the psychophysiological changes that characterize the sexual response cycle and cause marked distress and interpersonal difficulty. It is divided into two etiologies, namely the psychogenic etiology and the organic etiology. The disorders that are included for the psychogenic etiology are the sexual desire disorders such as the hypoactive sexual desire disorder and the sexual aversion disorder. And the second, the sexual arousal disorders such as the female sexual arousal disorder and the male erectile disorder. Third are the orgasmic disorders such as the female orgasmic disorder, the male orgasmic disorder, and the premature ejaculation. Fourth, the sexual pain disorders such as the dyspareunia and the vaginismus. Next, sexual dysfunction due to a general medication and the substance-induced sexual dysfunction and the sexual dysfunction not otherwise specified. Another etiology is the organic etiology that includes the disorders, the substance-induced sexual dysfunction disorder, the sexual dysfunction due to a general medication condition, and lastly, the sexual dysfunction that may be from the combined factors, the psychogenic and the organic factors. Moving on to the next category, which is the lack of sexual satisfaction from the sexual behavior, which is, we can say, this designates the impairments of the five components at the orientation, the intention, the desire, arousal, and the orgasm. This factor leads to sexual dysfunction, not otherwise specified, which is included in the psychogenic etiology that we previously tackled, and then the sexual identity difficulties, and then the sexual dysfunction that we previously discussed in the first category. Moving on to the last category, the sexual identity difficulties that is related to a person's thoughts and feelings that the gender they were assigned at birth is not consistent with their desired gender or genders that causes distress and difficulties around their identity. The sexual identity difficulties are divided into three classifications. The first one is the gender identity struggles that includes the gender identity disorder of childhood, adolescence, or adulthood. And then the next one is the gender identity disorder not otherwise specified. Second classification are the homosexualities that are not typically given of a psychiatric diagnosis, but commonly or occasionally classified as sexual disorder not otherwise specified. And then the third classification, the last classification, are the unusual intentions that includes the paraphilias that are sexual crimes. For example, the pedophilia, voyeurism, the exhibitionism, the rape or the sadism, and the fetishism. And then the next one is the paraphilias that are not sexual crimes. For example, the masochism, the transvestic fetishism, and the fetichism. Then the third one is the paraphilias that are not otherwise specified. Examples include but are not limited to telephone eschatologia, necrophilia, partialism, the zoophilia, the coprophilia, prismaphilia, and the urophilia. The psychological factors of sexual disorders are the feelings, thoughts, and perceptions that cause the sexual problems, and then the negative feelings for the partner and the shame for one's own body, then the unpleasant events of the past, the fears and restraints related to sex, and then the social factors are maybe values and standards that you have received during your education or in your education, and then the traumatic events or the behavior of the partner, and then the stress factors. So that's all for the disease process. In general, the classifications of sexual disorder are the gender identity disorder, the sexual dysfunctions, and the paraphilias. The gender identity disorder will be discussed further by John Ubel and Navarra.
Hello everyone, I am Janubel and Navarra, and for today's video, I am going to discuss about the Gender Identity Disorder or the GID. What is the GID? The Gender Identity Disorder or the GID is a disorder characterized by persistent thoughts and beliefs that the individual is trapped on the opposite sex body. The GID is usually common in males. Um, The gender identity disorder or the GID has three types. The first one is the gender identity disorder transsexualism. The second one is the gender identity disorder dual role transvestism. And the last one is the childhood gender identity disorder. In gender identity disorder transsexualism, a person can be persistent in significant discomfort regarding one anatomic sex. It, it can also be it they can also feel that one sex is inappropriate to one's gender. A person a person also wishes to get rid of his or her genitals. The person can also adopt secondary sexual characteristics of the other sex, and some person that has GID transsexualism can they also undergo in sex change. In the gender identity disorder dual or transvestism, a person can have this following. Um, they can al- they are wearing clothes of the opposite sex, and they have no desire of permanent sex change. In childhood, gender identity disorder is where it is similar to the transsexualism with every early age of consent. In GID or the gender identity disorder is it has a treatment or a therapy. So these are the treatment or the therapy. Um, the first one is counseling, uh, sex change, and psychotherapy. And in, that's all for the gender identity disorder.
Good day, everyone. Today I will discuss to you the number two classifications of sexual disorder, which is sexual dysfunction. Let's define what is sexual dysfunction is. When we say sexual dysfunction, disorders involving either a disruption of the sexual response cycle or pain during intercourse, meaning it refers to a challenge or problems that occurs during any stage of sexual activity, and this may be a clinically disturbed as the sexual response or the ability to experience sexual pleasure that cannot be fully accounted it by a medical problem. So what are the signs and symptoms of sexual dysfunction? So in women, she has experienced inability to achieve orgasm. Second is inadequate vaginal lubrication before and during intercourse. And third one is inability to relax the vaginal muscles enough to allow intercourse. Then for men, he experienced inability to achieve or maintain an erection or hard penis suitable for intercourse, and absent or delayed ejaculation despite enough sexual stimulation or retarded stimulation, and an inability to control the timing of ejaculation. So what are the types of sexual dysfunction? We have four types of sexual dysfunction. Number one is sexual desire disorder. Number two is sexual arousal disorder. Number three, orgasmic disorder. And lastly, number four is sexual pain disorder. When we say sexual desire disorder, it is the lack of sexual desire or interest in sex. There are two examples of sexual desire disorder. We have hypoactive sexual desire disorder and sexual aversion disorder. Then for treatment or therapy for sexual desire disorder, we have sex therapy or psychotherapy and administer antidepressant medications or bupropion. So when we say sex therapy or psychotherapy, we need to use a psychoeducation about factors which lead to decreased desire or arousal for both partners, and we need to prioritize the time for sex or intimacy in a couple or masturbation for an individual, and we need to increase their sensation or pleasure, focus on sexual activities, and mindfulness exercises to increase the somatic awareness for individuals. And when on the other hand, when we say administer depressant bupropion, so it can be prescribed as substitute for or supplement to other antidepressant or the SSRIs, I mean, which believed to cause a decrease in sexual desire. Then we need also use a treatment or therapy which is what we call cognitive behavioral therapy. So when we say cognitive behavioral therapy, this therapy is used for sexual aversion disorder. So it focuses on challenging and changing distorted thoughts, beliefs, and attitudes and their corresponding behaviors, and also to improve emotional regulation and develop personal coping strategies that target anxious symptoms. And when we say psychodynamic psychotherapy, so it is a treatment of choice for those who report psychic pain as a component of their sexual aversion, or those who conceptualize their problems as symptomatic of early childhood issues. So this form of treatment should emphasize deeper conflicts, defense mechanisms, and transference, as well as integration and behavioral strategies and insight-oriented approaches. Then next is sexual arousal disorder. So it is an inability to become physically aroused or excited during sexual activity. So meaning sexual arousal disorder, so your body doesn't respond to sexual stimulation. So it characterized by a lack of motivation to engage in sexual activity and absent or significantly reduced sexual thoughts and fantasies. So there are two examples. So we have frigidity or female arousal disorder and impotence or male erectile disorder. So what are the treatment or therapy for sexual arousal disorder? We have psychotherapy, sex therapy, and cognitive behavioral therapy. When we say psychotherapy for sexual arousal disorder, it can help people struggling with a number of different issues and problems. So most people seeking therapy, who are struggling with stress, difficult emotions, or symptoms of an underlying mental health issue like anxiety or depression. And this therapy can help people find relief from these concerns, as well as help them identify and resolve issues in their work relationships or other areas that are impeding their quality life. Then next for sex therapy, so just same also naman sa psychotherapy. Then for cognitive behavioral therapy for sexual aversion disorder or sexual arousal disorder, so it is a brief therapy treatment that works to change a person's thoughts and behaviors in order to improve their mood or functioning for men, and it is used to a range of problems including anxiety, depression, and sleep difficulty. So that this cognitive behavioral therapy is used for therapy or treatment in impotence or male arousal disorder. Next, let's proceed for sexual orgasm disorder. So when we say sexual orgasm disorder, it is a delay or absence of orgasm or climax. There are two examples, so anorgasmia and premature ejaculation. So kapag sinabi natin sexual orgasm disorder, so much less intense even though the sexual stimulation is sufficient and the woman is sexually aroused mentally and emotionally. So there are treatment or therapy for sexual orgasm disorder. We have cognitive behavioral therapy, relaxation technique, self-stimulation therapy, psychotherapy, and SSRI. So in cognitive behavioral therapy and psychotherapy, it's just the same also. since it may be useful for women or men who have been sexually abused or have psychological disorders. So these therapies may help women identify and manage fear of vulnerability and issues of trust with a partner. For relaxation techniques, it focuses exercises or deep breathing exercises in sensate of focus exercises. So the partners take turns touching each other in pleasurable ways. So couples may try to more different or stimuli such as vibrator, fantasy, or erotic videos. So gapamagsak na erotic videos in order to provide a relaxation technique. So when we say vibrators, it may be especially useful when there is nerve damage. And the SSRI or the or we need to administer an antidepressant just like the bupropion, so it is recommended by the doctor. Next, another treatment or therapy for sexual orgasm disorder is the cognitive behavioral therapy for premature ejaculation naman to. So there are two techniques, the start and stop techniques and squeeze and therapy techniques. So when we say start and stop techniques, it recognized as the most effective behavioral treatment for ejaculatory control. So the stop and start technique involves stopping stimulation as soon as the urge of orgasm arises. Then we need to wait 60 seconds, then resuming stimulation until the urge rises again and repeating multiple times. When we say then, on the other hand, squeeze therapy naman, it's similar to stop and start technique, which is it involves squeezing the area between the shaft and the glands of the penis when the urge to climax rises for approximately 30 minutes, then resuming sexual activity and repeating multiple times. So, squeezing technique ay para siyang you can feel awkward or mechanical since it particularly during partner sex. So it can occasionally affect the erection of the penis as well as which is why the stop start technique is generally superior, and however trying both techniques is worthwhile to establish which technique is more effective for an individual. And last is the sexual pain disorder. It is the pain during sexual intercourse. So there are two examples, the dyspareunia and the vaginismus. So kapag sinabi natin dyspareunia, it refers to pain during sexual intercourse. So it mostly affects women. And pain can range from moderate to severe, and reasons can be physical or psychological, and they may be related to menopause. And on the other hand, vaginismus, these contractions can prevent sexual intercourse or make it very painful. So this can happen when your partner attempts penetration, when a woman inserts a tampon, or when a woman is touched near the vaginal area. So what are the treatment or therapy for sexual pain disorder? Same naman sa other disorders, we have psychotherapy or sex therapy and the cognitive behavioral therapy. Next is paraphilia disorder, will be discussed by Honey Pearl as PATRICIO.
So let us discuss the paraphilia. So it is a mental health disorder term recently used to indicate sexual arousal in response to sexual objects or situations that are not part of societal normative arousal or activity patterns. So it is common in distressing and repetitive fantasies, urges, or behaviors. So here are the types of paraphilia. So let us discuss the types of paraphilias. So first is the exhibitionism. So it is a sexual pleasure gained from showing one's genital to non-consenting individual. So it is a sexual gratification through display of one's genital. So next is the fetishism. So it is a sexual pleasure derived from fantasizing or caressing objects, like for example is the underwater. So it is linked to an abnormal degree to a particular object. So next is the frotteurism. It is a sexual pleasure derived from rubbing one's private part or non-consenting people, usually done in the crowded places. So next is the pedophilia. It is a sexual pleasure derived from having sex with pre-pubertal children. It is the person who has sustained sexual orientation toward from the children 13 years old or younger. So masochism is a sexual pleasure derived from receiving pain or may be imagined. It is the enjoyment of what appears to be painful. So next is the sadism. It's a sexual pleasure derived from inflicting pain from someone else. Next is the transvestitism. So it is a sexual pleasure derived from cross-dressing. So it is the practice of wearing the clothes of the opposite sex. Next is the voyeurism. It is a sexual pleasure derived from watching naked people or people having sex. Next is the telephone scatologia. It is the phone sex. It's either maybe text, chat, or through video calls or voice call. Next is the necrophilia. So it is a sexual pleasure derived from having sex with a corpse. So it is being excited or attracted to dead bodies. So next is the partialism. It is a sexual expression limited to one part of the partners of oneself's body only. So it is a specific interest on parts of the body like breast, hair, or the buttocks. Next is the zoophilia. So it is a sexual pleasure derived from sex with animals. So it is a sexual attraction of a human towards non-human animals. Next is the coprophilia. So it is a sexual pleasure derived from eating feces or being smeared with. Next is the cropophilia. So it's a sexual pleasure derived from eating feces or being smeared with feces. So next is clismaphilia. So it is a sexual pleasure derived from having enema. Next is the urophilia. So it is a sexual pleasure derived from urinating one's partner or being urinated. So it's sexual depending on a smear of. Next is the urophilia. So it is a sexual pleasure derived from urinating one's partner or being urinated. So next is the gerontophilia. So it is a sexual pleasure derived from having sex with all adults. So it refers to sexual preferences for the elderly. Next is for the symptoms is usually depressions or anxiety. So for the treatment or therapy, psychotherapy and anti-androgen drugs and SSRIs or the selective serotonin reuptake inhibitor. It also included the fluoxetine and the fluvoxamine.